Okay, so I'm live on YouTube and then TikTok. Going live in 3, 2,
Simultaneously.
1. Yes. I'm just praying that the data will be enough for both.
All at the same time, it's maintain the brother.
Hello, everybody.
A speaker.
Welcome to my live today. Today, we are going to do a very special combination. I'm going to do a YouTube live in addition to doing a TikTok live at the same time. Today's topic is kidney health. Kidney health is 10 minutes after 8. Today, I'll be the sole host and the sole player. Yes, today I'll be handling every single thing about this live. So, basically, to be a teaching session. So, I'll answer questions about kidney health. You know, Papa? On left hand. I'll answer questions about kidney health. I'm trying to be able to add. I'm trying to be able to add a picture of the kidney to the display so that it's nice, but I can't find a picture of the kidney. So that it will be easy for people to pick up on exactly what we are discussing. Anyways, while we are waiting for us to get a picture of the kidney, I have a friend here who will introduce himself. His name is Ima. Ima, say hi.
Hi, my name is Emmanuel.
So Ima will be in the background and Ima will be asking me questions on the kidney condition. Then hopefully you have the opportunity to have a discussion on kidney disease. So hopefully next time I'll learn how to add a picture to the live so that you see the kidney as we are discussing. So you can start.
Okay. What's the function of the kidney?
So basically, every human being has two kidneys, right? We all have two kidneys. It's found somewhere in our flanks towards the back, right? There are two kidneys. The right one is a bit lower because the liver is on the right, and the liver pushes the kidney down a bit. So the right kidney is slightly low than the left kidney. They are both towards the back. So most of the time, for example, if you have a kidney problem, you can feel some pain at your back towards your waist. So that is the special thing about kidney disease. So usually kidney's function is simple. The kidney's function is to clear toxins, to clear excess water, to clear excess acid, and to make sure that your body has a very good balance. So a good balance of water, a good balance of electrolytes, a good balance of acids and everything. So that's the main purpose of the kidney, to make sure that it has a very, very good balance in the body. So if, for example, you are drinking a lot of water, the kidney will make sure that you are urinating a lot so that it will maintain the balance. If, let's say, you're taking a lot of salt, your kidney will make sure that it takes out a lot of salt to keep the balance. So that's the main function of the kidney. Yeah, to keep that balance.
Okay.
Do you have
You,
any other
you made
questions?
something profound like
Speak up.
you said sometimes when you are getting kidney problems, you experience some sharp pain or something around your back. Is it always indicative that when you have a kidney issue, that pain will have to maybe come?
So basically, the kidney, like every other organ in the body, has this nice capsule, this nice shell that surrounds it. And when there's an inflammation, okay, or when there's an infection, first of all, it can stretch these shells. And when it stretches the shells, there is pain. And secondly, there's small, small cells in the kidney. They all have these individual shells. And when these shells are stretched, there is pain. And because of the kidney's location at the lower back, when there is that stretch, naturally, there will be pain. So that's exactly how there is pain when there is kidney disease. So apart from the pain, depending on how severe it is, you can even see blood in your urine. You can see blood in your urine. You can even have blood in your urine when you wake up in the morning, afternoon, all the time. in addition to having pain at your back.
So how does the kidney work in hand with other organs in the body to ensure that the body is functioning adequately? Maybe it has some connection with the heart, let's say the kidney, together with, let's say, the heart, liver. How do they relate? How do they coexist in the human system?
So basically, the kidney has a direct effect on the heart, and the kidney has a direct effect on the liver. In terms of the heart, the kidney produces something we call angiotensin. Now, this angiotensin works on the heart to help the heart to contract and to pump out blood. So, for example, if someone has hypertension, we want to control the hypertension. One of the medications we give is to block this angiotensin. So when we block the angiotensin, it cannot go to the heart to help the heart to pump out blood. So that's one of the main functions that the kidney has on the heart. Kidney also has some effects on the liver. For example, the liver has to, let me say, look at the blood that the kidney receives. So before the kidney receives the blood, it goes to the liver. So if there's a liver problem, the kidney's blood will be affected. So that's also the relationship that the kidney has with the liver. So any problem that affects the kidney can affect the liver, can affect the heart. Any problem that affects the liver can affect the heart. The liver too is linked to the heart. Every blood the heart receives is from the liver. So any problem that affects the liver can affect the heart, can affect the kidney. And any problem that affects the heart can also affect the kidney and affect the liver. So it's like a triangle. Those three, they work hand in hand. And every time that doctors are taking care of one or two of them, you make sure that you look at the third to make sure that it is also functioning very well.
Okay. How can you check that maybe your kidney is functioning well?
So usually the best way to check kidney function is to do a blood test. Okay, there are two main, let me call them toxins that are cleared by the kidney. The first one is something we call creatinine. Now, creatinine is produced by the muscle. It's a byproduct of muscle breakdown. So when the creatinine is produced by the muscle, it's naturally cleared by the kidney. So if you realize that the creatinine levels are going up, then it means that the kidney is not able to clear the creatinine. Then there's a kidney problem. So that's the first thing we look at. We look at the creatinine. The second thing we look at is the urea. Now, urea is also a product of protein metabolism. When protein breaks down, for example, you eat your fish, you eat your meat, you eat your beans, all the things that mix with all the let me be very respectful. When you pass